Founder and producer Professor Ahmed Mamdouh Al-Sharif, Professor of Epidemiology and Infectious Diseases of Animals, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Anusyuf University presents Technical Veterinary Learning Channel. قلبي يعتصره الألم وأنا أسجل هذا الفيديو لشرح هذه المحاضرة المهمة في الطب البيطري، لكن الحرية لها ثمن. فلسطين تقاوم وتنتصر. الله سبحانه وتعالى في قرآنه العظيم يقول: بسم الله الرحمن الرحيم: وأعدوا لهم ما استطعتم من قوة ومن رباط الخيل ترهبون به عدو الله وعدوكم. صدق الله العظيم. ومن باب إعداد القوة فإننا يجب أن نعرف كل ما تصل إلينا وكل ما يوجد من العلم في العالم لنكون قد أطعنا هذه الآية ولنكون قد نصرنا فلسطين التي تقاوم وتنتصر. Dear colleagues, my heart is broken on the children, on the women, on the older people that died in Gaza without any claim. Unfortunately, the whole world is silent, and what is called themselves the New World support Zionism in their actions against Palestine. And we explain this lecture obeying Allah in His orders to do what we are able from forces. In the Quran, Allah said, in the name of God, the most gracious, the most merciful, and prepare against them whatever force you are able, and of the tether of horses with which you may terrify the enemy of God, and your enemy, God Almighty, has spoken the truth. Please support Free Palestine. Today we will be speaking about an important subject in veterinary medicine: the diagnosis and differential diagnosis of diseases causing nervous disorders in large ruminants. The picture that appear here is a symptoms of BSE at the beginning of this disease in an infected cattle. This is a prominent. Nervous signs are present. In the following slides, we will discuss how we can diagnose and differential diagnose these nervous diseases, as well as differentiate it. It's coming from central nervous system infection or injuries, or it's coming from BNS or peripheral nervous system infectious or injuries. The important steps for diagnosis of diseases causing nervous disorders in large ruminants, either it coming from the disorders in the central nervous system or peripheral nervous system, will be in the following steps. Number 1, we have to know the history and epidemiological findings of the case. In case of tetanus, we have history of stabbing injury. We have a history of deep injury. We have epidemiological findings. It is sporadic, occur in one animal, and this is a clear example. Because of limitation in the neurologic examination of large animals, there must be more emphasis on the history and the epidemiologic findings, such as rabies disease. This picture explains how the disease coming from wild canidae to dogs and then to different wild animals and then to different domesticated animals and man. Many of the diseases have epidemiological character that give the clinician a clue to the possible causes, thus helping to narrow numbers of possibilities, such as polio, encephalomyelitis, trauma that occur in green feedlot cattle and sheep. So we seen here this goats cannot coming up and running as their sisters, so they coming down and said I can't. The toxic effect seen in a herd of beef cattle post exposure to ash residues contaminated by lead and mercury were nervous manifestation and seizures seen as in this picture. Clinical diagnosis of nervous diseases in large ruminants. The goal of physical examination in conjunction with blood biochemistry examination should be excluded common diseases from the differential diagnosis lists as following. Number 1, in neonatal patients, metabolic acidosis or hypoglycemia are common cause of neurological sign. In large ruminants, pregnancy toxemia or hypocalcemia are the common of neurological sign. Accurate neuroanatomical localization of the lesion. As we seen here in the spaces, when we clinical examined a prostrated cow, we try to locate the anatomical localization of the lesion. It is coming from fracture, or it's coming from lumps, or it is a rigidity, or it is coming from the lumbosacral area as in 3D thickness, are the fundamental requirement for creating diagnosis. And a differential diagnosis list, control and or treatment plan will be decided. Listeriosis, as we seen here in this video, where this ox is coming in circular movement, this clinical signs of asymmetric brainstem dysfunction and depression of the reticular activating system. The dysfunction is at the neuromuscular level, as in hypomagnesic tetany, where this picture showing a cattle shouting, complete pressurated in one side, with making nervous movement by their legs due to the neuromuscular level becoming affected due to this disease. Laboratory examination is an important step for diagnosis of nervous disorders. Radiograph examination by making X-ray or CT scan or by sonar for diagnosis the place of the dysfunction. Radiographic examination, including myelography, is not used routinely as a diagnostic in large animal practice, but may be done for research purposes, as we see here an X-ray of the skull of an ox. MRI examination. MRI examination is not used routinely as a diagnostic aid in large animal practice, but only for very valuable animal and serious cases as bovine spongiform encephalopathy, which is a questionable disease. Cerebrospinal fluid or CSF examination. Collection of cerebrospinal fluid from different spaces and ages of large animals without causing damage to the animal or contaminating the sample with blood is a technique that few large animal veterinarians have been mastered. So, under sonar, as we seen here in the picture, we put the needle at the junction between the skull and the first vertebra to collect the CSF. However, collection of CSF from the lumbosacral cistern is not difficult in the animal, as adequately restrained, and the information obtained from analysis of CSF can be very useful in differential diagnosis of diseases of the brain and the spinal cord that is caused by viral or bacterial pathogenic agents. This picture showing atlanto-occipital puncture and CSF collection where the neck is flexed and the needle is inserted perpendicular to the long axis. Differential diagnosis of nervous diseases. The first step when examining an animal with apparent abnormalities in the nervous system is to determine whether other relevant systems are functionally normal or not. Nervous systems work with different systems such as the eyes with vision, such as the musculoskeletal with locomotor, such as digestive system, such as the respiratory system. A decision to implicate the nervous system is often made on the exclusion of other systems. In this short video, if you are not an expertise clinician, you can say that this cattle will suffer from PSE, but the truth that this cattle is very happy with playing with this machine that may scrapings gently to the cutaneous area of their head and neck. Modes of nervous dysfunction. Number 1. Excitation signs. This cattle showing excitation and irritation phenomena. It may be due to presence of tick, or presence of Ogesques disease. Then the third one is the release of inhibition signs and nervous shock and altered their mentation or their mental alteration. The modes of nervous function also include involuntary movements, abnormal posture and gait, paresis and paralysis, altered sensation, as well as blindness. Keep on the track for following me on the Technical Veterinary Learning channel to have the most newest information about all veterinary infectious diseases.